I'm Vicki Liviakis, and welcome to Body Beautiful. It's our weekly show where we talk with local doctors and other professionals about the latest in cosmetic procedures, and we take your calls live on the air. With us today, we have plastic surgeon Dr. Joseph Mele, followed by Michelle Miller, who owns Simply Beautiful. And we'll explain that later on. Also later, we'll be taking your calls and emails, answering any questions you might have. Here's the phone number, 800-440-4884. We'll also be posting the phone numbers to the doctor's offices, so be ready to jot those down. Now, before we get started, any advice we give you today, obviously, you're going to want to consult your own physician. Welcome back, Dr. Mele.
Thank you. Nice to be back.
Well, you are a board-certified plastic surgeon, which is very important when someone is shopping for a plastic surgeon.
Yes.
That's one of the first things you look for, is it not?
It's very important. It means that your surgeon has had proper training and that there's been some review, not only of their training, but also of their practice after training. There's certain certification exams that are required, both written and oral, as well as review of cases that are done. So it's pretty thorough in order to be a certified surgeon. And it's now ongoing. It used to be that you were board certified once you graduated, and that was it. Now, every 10 years there's an exam, and every couple of years there's other paperwork and reviews that are done. So.
And you are board certified and proud of it.
Very happy to be board certified.
Okay. Dr. Mele, let's face it, we are a breast-obsessed culture.
Well,
are we not?
Some more than others, yes.
Okay, but the breast augmentation surgeries, but this seems to be kind of is that like one of the #1 plastic surgeries being performed these days?
It is. Liposuction usually is #1, but breast augmentation and eyelid surgery are usually 2 and 3, sort of neck and neck, though the breasts have been in the lead lately. Part of that may be approximately 1 year ago, the FDA re-released or remove the restrictions on the silicone-filled breast implants.
There was a lot of concern about that. That has now gone away, but the saline implants are still available for folks.
Well, they're still available. What's interesting is prior to all the controversy, about half the implants used were silicone and half were gel, or half were saline, and we've kind of gotten back to that. After a year, we're sort of pretty close to 50-50. I know it is in my practice, and talking to other doctors and talking to the manufacturers, that's about where we are again.
All right, now you talked to me off screen here a little bit about something new the FDA may be considering. Can we talk about that a little bit?
There is. The manufacturers can't talk about it until it's approved, but I can talk a little bit about it. And it's not completely new in that it's been in Europe for 8, 9, 10 years now. When there was restrictions placed on implants, this was 15 years ago, it took Europe about 6 months to re-release the gel implants. It took us about 14 years, so we were a little slower. During that time, other developments were made, and one of the developments was surgeons noticed it was easier to clean up after a ruptured implant that was full of gel if it was stickier inside. So that thought process was taken one step further, and now there are implants that are actually a solid. It's a soft solid, sort of like a stress pillow, stress ball, but they're made solid so they can be made of different shapes, and they never leak. And there's going to be a huge advantage, I think, for patients who are undergoing reconstructive surgery, who we need to form a shape to the breast because the skin just doesn't give us that right shape anymore.
So this would be after a mastectomy.
After
you want
mastectomy.
Something that actually has the shape of the breast.
Because with the implants that we have now, the skin really determines the shape of the implant. The inside is fairly liquid, fairly fluid, and if the skin's been removed, we end up with a fairly flat breast. We don't end up with a lot of projection. With these, we can enforce the shape with the shape of the implant. They come in 16 different shapes, different heights, widths, volumes. It's very, very fascinating, and I'm looking forward to being able to use them soon. But I don't know when they'll be released.
Okay. Well, I'm sure you'll keep us posted about that. Say a woman is considering breast augmentation or a breast lift. What's the difference? And
Augmentation has more to do with increasing volume. Again, since the shape is mostly from the skin, the lift is to change the skin. And changing the shape of the skin will do a couple things. One is bring the nipple up higher on the breast if it's dropped secondary to weight loss or childbirth. And it'll also change the shape if there's some sagging of the native breast tissue.
Okay, now you brought some before and after pictures. We've got emails and the phone lines are already lighting up. We want to address those, but we need to go to a break. So in the meantime, if you want more information about Dr. Mele, you can call 925-943-6353 or go to drmele.com. And when you call his office and mention Body Beautiful, you'll be able to receive a complimentary consultation. We'll be taking your phone calls and continue our chat about plastic surgery when we come back on Body Beautiful. Welcome back to Body Beautiful. We're talking right now with Dr. Joseph Mele. He's a plastic surgeon. We'll be taking your calls with any questions you have about plastic surgery. Number to call, 800-440-4884. We'll also be posting the number for the doctor's office as well as during and at the end of this segment. Remember, any advice we give you today, you're going to want to consult your own physician. We promise the before and after photos. I do want to put a little disclaimer in there. Some of them are a little bit graphic.
Yes.
Before we get to those phone
put
calls.
some black bars there, but
Okay. All right. So let's go ahead and let's go to our first one here. Looks like we have a chin implant.
yeah, this is a chin augmentation. So this is a patient who has a fairly receded chin, and then by putting an implant in there, even a small implant can make a big difference. We can bring that chin out back to the level of the lips.
Yeah.
It just gives a stronger appearance.
I saw that our little logo 4 there, and I thought, you're implanting the 4. That's, thank goodness that's gone now. But beautiful, beautiful difference here. Okay, let's move on to a woman who's had a mini tummy tuck and liposuction.
Yeah, sometimes the looseness in the abdominal wall is isolated to the lower part. Most commonly in younger women, sometimes after childbirth, sometimes just with weight loss. And this is a combination of liposuction and sort of a half a tummy tuck procedure, just addressing the area below the belly button with the tummy tuck.
Okay, and then we have breast implants. We were talking about this earlier.
Yeah, this is the graphic one. So this is pretty obvious what we do. These types of pictures are available all over the internet. But essentially, we're putting in implants in this case, underneath the muscle, which gives a nice tapered shape, not that round appearance that's sometimes seen with the implants in front of the muscle.
Okay. You know, we were talking about, well, since we're on the subject of breasts,
Yes.
we have an email from Gina, or rather Gloria in San Francisco wants to know if it's safe to breastfeed with implants.
Absolutely.
What do you say to that?
In fact, the current recommendation is to breastfeed if you have implants in place.
And why is that?
Because breastfeeding is good for children. And
Yes,
the
of
implants,
course, yes.
and the implants don't interfere with that.
Okay, well, first things
especially when
first.
they're behind the muscle. They're not in the breast tissue themselves. They're not going to change the milk or taint it. The only problem with implants and breastfeeding is sometimes the breast gets tricked into thinking it's full sooner than it would be all before. So we end up making a little bit less milk.
Huh, all right. Gina from San Mateo, let's go ahead and go to the calls. Are you with us this morning?
Yes, good morning.
Good morning. You have a question about breast augmentation.
Yes, indeed I do. I'm an African-American woman, and I just have a fear of keloiding. Now, I'm very much interested in getting breast augmentation, but I'm in fear that once I get it, the aftermath, I might keloid. So is there a way to, check or, I don't really get it. Is there a way to prevent that, prior to the incision?
Well,
Doctor?
it has something to do with how the body reacts to any sort of injury. If you've had your ears pierced and had trouble with keloid there, then you're going to be at higher risk for getting keloiding on the breast. It's a different area. It's interesting. Keloiding can happen, with different people in different areas, different times, but it's not consistent. So sometimes we think we're preventing it, but maybe it just wasn't going to happen that time.
Any topical creams that help?
There are many things I do sort of routinely. The simplest thing is just massaging a scar. It helps to remodel the collagen and help things smooth out. Following along closely also helps. If the scar seems to be getting red or raised early, sometimes steroids or other things can be done short of going back and redoing the
Now,
scar.
doctor, I understand there's also surgery. You can go back in and you actually cut the
Yes.
keloid tissue and
Yes.
allow it to.
Yes, and that's usually done in conjunction with steroids or some other topical treatments, again, to try and minimize the body's reaction to the injury.
Okay, Gina, hope that answered your question. Let's move on to Mary from Hayward. She has a question. Good morning, Mary.
Good morning.
You have a question for the doctor.
Yes, I do. I recently had some facial surgery down around my jaw and my chin. And I just wonder, this was in September, and even up to today, when I touch around my ear, in the front of my ear and towards the back where the stitching was, I feel like little tingly numbness pain.
Sure, that's normal.
And I would just wonder if that's normal, or should I consult somebody about it, or what?
If it's not distracting, then it's normal. Certainly it's something I would bring up with your surgeon and ask them, if this is a normal thing, and have them check the area very closely. But when we do surgery like, say, facelift, jowl lifts, we're lifting the skin in front of the ear. We're actually cutting those nerves, and it takes a while for them to come back. Usually a year, sometimes takes even longer to completely improve.
Okay.
But by cutting those nerves, letting them heal, they tingle and they sort of protest as they get better.
Thank you, Mary. Do we have time to take another call? Betty from San Francisco. Betty, you have a question, really quick question for the doctor?
Okay, what does the doctor think of these 1-hour facelift things that are advertised on television?
I think that you need to look very carefully in terms of what's being done and how it's being done. You want to evaluate before after pictures, the doctor's experience, and certainly how much needs to be changed. For small changes, I think it can work very well. For larger changes, then something more might be done.
Okay, I hope that answered your question, Betty, and that was a quick
Try to be
response.
quick.
Thank you, doctor.
That's a
And
hard question to answer quickly.
it is, yes. Unfortunately, we are out of time, but if you want more information about Dr. Mele, just call 925-943-6353 or go to drmele.com, and when you call Dr. Mele's office and mention Body Beautiful, you'll be able to receive a complimentary consultation. When we come back on Body Beautiful, we'll have Michelle Miller, who will tell us everything we need to know about how to be simply beautiful.